call the member for Kooyong.
Thank you, Madam Deputy Speaker. I rise to follow a very good speech by my colleague and friend, the member for Bradfield, on a very important topic, namely the Private Health Insurance Amendment, Lifetime Health Cover Loading and Other Measures Bill, as well as the Private Health Insurance Legislation Amendment Base Premium Bill. Both bills have come before this House because this government has a budget crisis, indeed a budget emergency, approaching $300 billion of debt and having overseen the 5 largest budget deficits in Australia's history. And so they are having to embark on broken promises, and they are having to claw back money from those Australians who have taken the decision themselves and based on personal responsibility and their freedom to choose to undertake private health insurance. And as a result, all premiums for all Australians who undertake private health cover will go up. And not only will a private health insurance rebate no longer cover the loading component of lifetime health cover, but it will also see premiums for those receiving the rebate currently also go up. And this will hit many people in my electorate of Kooyong. Based on figures provided by Private Healthcare Australia, the percentage of voters in my electorate with private health insurance is 84.5%. That's over 105,000 persons in my electorate, including 25,000 singles. Now, that is a lot of people in my electorate, and that is repeated across the country because more than 12 million Australians have taken out private health cover. Now, Madam Deputy Speaker, it is a shame. It is a deep shame that the Labor Party has undertaken these measures, because not only did it promise before previous elections that it would never touch private health insurance, but it will increase the cost of living for all Australians, and it will increase the burden on our public hospitals that are already suffering from Labor government cuts. We on this side of the House, Madam Deputy Speaker, have a different philosophy to those on the other side. Politics is not just about management, but it's actually about ideas. And on our side of the House, we believe in an individual's freedom to choose. We believe in an individual taking personal responsibility for their decisions. In fact, in a speech in Camberwell Town Hall back in 1946, the founder of the Liberal Party and a previous member for Kooyong, Sir Robert Menzies, delivered an important speech that kick-started the federal election campaign. And he said in that speech, "We need to return to politics as a clash of principles and to get away from the notion that is a clash of warring personalities." And I put it to you, Mr Deputy Speaker, that there is no more important issue than the private health sector, the private education sector and an individual's freedom to choose. And that's why we on this side of the House will always defend the private health sector and allow an individual the right to choose. Now, Mr Deputy Speaker, in Australia, more than nearly 12.5 million Australians have made the decision to take out private health insurance. And this increased substantially during the time of the Howard government. Indeed, it increased 75% from just over 6 million Australians to 10.7 million Australians. And it was a result of inspired policies that the Howard government undertook. The Medicare levy surcharge in 1997, the rebate, the 30% rebate in 1999, the lifetime health cover policy in the year 2000. And as a result, we now have a flourishing private health sector which is under threat from Labor's cuts. Nearly 600 private hospitals in Australia provide nearly 40% of the services to those who go to hospital. Nearly 2 out of every 3 elective surgery operations are conducted within private hospitals. So private hospitals play an important role in our community in alleviating the burden on the public system. And not only did the Howard government have a very proud record of increasing its support for the private health system, but it also supported the public system. Indeed, spending on public hospital expenditure increased 110% between 1996 and 2007, the period when John Howard was in office. Let me repeat that. We increased the number of people on private health insurance by 75%, and at the same time we increased the amount spent on public hospitals by 110%. Contrast this with Labor's record, where in MyEFO last year they ripped out more than $1 billion out of Australia's public hospital system, and in my state of Victoria, some of that money was ripped out retrospectively. So you had to see beds cancelled and elective surgery cancelled. And then you had Tanya Plibersek, the Minister for Health, doing a public backflip because she saw the pain that this was creating to thousands of Victorians. And we know that this government has introduced the means test into private health insurance, which companies like Deloitte had estimated would cost to see more than 500,000 Australians either drop out or diminish their levels of private health cover. Now, we have not seen the full impact, Mr Acting Deputy Speaker, we have not seen the full impact of the means testing of the rebate, because more than $1 billion was spent in Australians prepaying for their private health insurance. That's a very important fact. They prepaid for 12 months or more, and as a consequence we haven't seen the flow-through of the impact of the higher premiums that will result and have already resulted from the government's means testing of the private health insurance rebate. Now, there is one significant mistaken belief that those on the other side have about private health insurance. It's part of their class warfare, where they think that every Australian who has private health insurance is a rich Australian. Well, I tell you, they're not rich. In fact, they're aspirational. In fact, they take responsibility for their own health care, just like many of them take responsibility for the education of their own children. But you are attacking them with your means testing on the rebate and with your new measures affecting the loading and so forth under these bills. There are over 5.5 million Australians with private health insurance where their household income is under $50,000 on an annual basis. Over 5.5 million Australians with a household income under $50,000 who have private health insurance, or nearly 3.5 million Australians who have under $35,000 as their annual household income that have private health insurance. Mr Deputy Speaker, these people are not rich. These people are not rich but have taken the conscious decision to take out private health care because they want to make that choice for themselves and their families. Now, Mr Deputy Speaker, we have learnt in the last 5 years what a bad government can do to damage the Australian economy. The Australian people have learnt never to trust the words of another Labor government, and they will find this out on September the 14th. But what we are debating now about private health insurance brings into focus the commitments by senior members of those opposite to retain the private health insurance rebate in its form. The current Prime Minister, Julia Gillard, when she was Shadow Minister for Health back in 2004, said, I quote, "I grow tired of saying this. Labor is committed to the 30% private health insurance rebate." Well, we now know that that's not true. Then Julia Gillard, in a letter to the editor of the Weekend Australian on the 15th of October 2005, said, "For all Australians who wanted to have private health insurance, the private health insurance rebate would have remained under a Labor government. I gave an ironclad guarantee of that during the election. The difference between Tony, rock-solid ironclad Abbott, and me is that when I make an ironclad commitment, I actually intend on keeping it." Now, Mr Deputy Speaker, that is laughable. That is absolutely laughable, because the Prime Minister is comparing herself to now the Leader of the Opposition, saying you can't believe him, but you can believe her. And we've seen not only with the carbon tax, but we've now seen with the private health insurance that their word cannot be taken at face value. Nicola Roxon, the Shadow Minister for Health, well, actually became the Minister for Health when she said this on the 23rd of September 2007 on Meet the Press, and I quote, "We've committed to it," namely the private health insurance. "We've committed to the 30%. We've committed to the 35% and the 40% for old Australians. It's similar to the safety net. We know that many people rely heavily on the assistance that is now provided and would not be able to have private health insurance if that rebate wasn't paid. And lifetime health cover and others that go with it. We are committed to those. We understand that Australia now has a mixed health system, both private and public. We need them both to be strong in order for the community to be able to get the services." Well, I'll be damned. That was the Minister for Health committing to the private health insurance rebate as we introduced it. Now we have had backflip after backflip, not only cutting more than $1 billion out of the public health system, but ripping money out of the private system, when we know that the private system is responsible for dealing with 40% of the patients in Australia and 2 out of every 3 elective surgery operations. That's the role of the private healthcare system, not the one, and this government is ripping the guts out of it. Nicola Roxon, in a media release on the 26th of September 2007, "On many occasions, for many months, Federal Labor has made it crystal clear that we are committed to retaining all of the existing private health insurance rebates." Well, we know that's not true. And Kevin Rudd, in 2008 as Prime Minister, in a press conference, "The private health insurance rebate policy remains unchanged and will remain unchanged." Mr Deputy Speaker, this is laughable. This is laughable because this government has destroyed our private health system, has cut our public health funding, has not kept its promises on the chronic dental disease scheme, has slowed down our pharmaceutical benefit scheme and the subsidies that are provided under that, and now has increased bureaucracy, at last count nearly 12 in the health sector alone, costing more than $1 billion, and now we have the private health insurance. Debacle. I call it a debacle because this government has promised time and time again, from Kevin Rudd to Nicola Roxon to today's Prime Minister Julia Gillard, to keep the private health insurance rebate as it was. And these bills, which this government has brought before the Parliament in a rushed manner, without proper consultation and deliberation, is going to lead to a substantial increase in the premiums, up to 27%. For more than 1 million Australians. It's going to lead to 12 different price mechanisms for private health insurance. It's going to increase complexity. And Mr Deputy Speaker, I want to finish where I started, where I say for the coalition, Liberal and National, this is not just a debate about the services that are provided to ordinary Australians, but this is about the philosophy of our party. This is about why we are in this place to start with and what differentiates our side from them. And the late, great Margaret Thatcher, who we recently lost, has talked herself about private health insurance, and she has said, "I, along with something like 5 million other people, insure to enable me to go to hospital on the day I want, at the time I want, and with a doctor I want." For me, that is absolutely vital. Like most people, I pay my dues to the National Health Service. I do not add to the queue, and if I said, "Look, because I cannot come when you want me, I must come when I want to," you would accuse me of jumping the queue. I exercise my right as a free citizen to spend my own money in my own way so that I can go on in the day and at the time with the doctor I choose and get out fast. Mr Deputy Speaker, that's why we will always support the private health system because we believe that that allows an individual to have the right to choose in a society that we will always stand for individual freedoms. Thank you.